Hi everyone, this presentation is on type 2 diabetes. What is type 2 diabetes? Diabetes is a chronic condition that affects the way your body processes food into energy. We all need sugar to help give us energy, to function, and to get through the day. The food that we eat gets broken down into sugar, also known as glucose, and then it gets released into your bloodstream. Insulin, which is released from your pancreas, is what helps turn that sugar into energy. When your body isn't producing enough insulin, or in this case for type 2 diabetes, the insulin is not getting used properly, the sugar gets built up in your bloodstream, which can cause diabetes. It can also cause other health issues such as heart disease, kidney failure, kidney disease, blindness, and even lower body amputations. Diabetes is a lifelong condition, so there is no cure. However, with a healthy diet, exercise, and medications, it can reduce some of the negative impact of diabetes. Over 30 million of Americans have diabetes. 1/4 of them do not know they have it, and it is the 7th leading cause of death. Some of the risk factors include being overweight, being over the age of 45, and having a family history with type 2 diabetes. Some of the other risk factors are smoking. Smoking can increase your chance up to 30 to 40%, as opposed to not smoking. Another risk factor is if you're not active. Prediabetes. Prediabetes is important to know because one of the factors of getting diabetes is genetics. 1/3 of the population has it, and 90% of them don't know they have it. Prediabetes means that your blood sugar is higher than normal, but not high enough to be diagnosed as diabetes. So, if you are diagnosed with diabetes, it's very important to let your family members know to get a regular screening and monitoring from the physician. That way it can help reverse prediabetes and also improve their lifestyle. And also lower the risk of other conditions that can come from prediabetes, such as stroke and heart disease. So how can we manage now that you have found out about your diagnosis? Eating healthy, choosing healthier options when eating out, getting physically active at least more than 4 times a week or 4 hours a week, managing your stress, getting and taking your prescribed medications properly, checking and monitoring your blood sugar levels. All of these things are very important steps to take to help you maintain good health, even if you're living with diabetes. So some of the great benefits of physical activity is that it helps reduce stress and overall improves our mood, so we can sleep better at night. It can also increase muscle strength and flexibility in our joints. And with that can prevent us from falling. It can also increase our energy and reduce other conditions such as heart disease and stroke. As we know, stress can permeate in other areas in our functioning. So if we don't feel good, there's a chance that we can't sleep at night or we can't function as well as we should. So some of the examples that are listed here are strength training, such as squats, sit-ups, push-ups, using resistant bands, cardiovascular activities such as hiking, dancing, rowing, jogging, aerobics such as going for walks, going for a swim, biking, and if you feel like you don't have time, there's also housework related physical activities that you can also try, such as gardening, cleaning, washing your car, walking the dog. Along with physical activity, it's important to have a healthy diet. Just because you have diabetes does not mean you cannot enjoy some of your favorite foods. It's important to choose some of the healthier options when you're out or when you're at work. That way that can help maintain your weight or even lose weight and overall lowering your blood sugar levels. Some of the important keys are don't skip your meals. Don't eat too much of one thing, and also keep portions in mind. So as you can see from this picture over here, it's important to keep in mind that half of your plate should come from non-starchy vegetables, 1/4 of your plate should be protein, such as lean meats, And the other 1/4 of the plate should come from other proteins such as beans, whole wheat, and other types of wheat bran. Lastly, stress. It's important to take care of yourself. Self-care is really important. So some of the ways to reduce stress is talking to a professional, talking to a family member, talking to a friend. And here are some of the list of professional help that you can get. Peer support groups, a mental health counselor, going to educational classes, going to your doctor appointments, making sure that you're not skipping that. And also you can speak to a lifestyle coach who can help you and learn from on how to stay active even if you feel like you don't have time, and also help you set some personal goals, help you plan with your diet, and also learn how to choose healthy options when eating out. So finally, what are some other resources for diabetes? You can contact 800 CDC info for more information on some of those educational classes so you can learn about a new improved lifestyle change. And you can also learn about enrolling in a free 12-month program that can send you educational packets for free to help you live well with diabetes. And here's the link below. So this concludes my presentation for type 2 diabetes. I hope you enjoy and live well.